Ever wondered about the common symptoms of cancer? Or perhaps you've been feeling off and don't know why? It's a topic that's as vast as it is vital. Cancer, a disease that has touched countless lives, comes in many forms, each with its own set of symptoms. Understanding these symptoms can be the first step towards early detection, a factor that plays a significant role in the successful treatment of the disease. From the most common types like breast and lung cancer, to the less prevalent ones like pancreatic or ovarian cancer, each type presents a unique set of signs. Recognizing these signs early can be a lifesaver, literally. Knowledge is power, and in this case it could be the power that saves a life. So, let's embark on this journey of awareness together, as we explore the various symptoms associated with different types of cancer. Stay tuned as we dive into the common symptoms of cancer. A sudden, unexplained weight loss can be a sign of various types of cancer. This is a statement that might raise eyebrows and spark curiosity. It's true that weight loss is often celebrated, especially in a world where achieving the perfect body image is a common goal. However, when weight loss is sudden, drastic, and unexplained, it may be a cause for concern. Cancer cells can be sneaky and deceptive. They can hijack your body's normal processes, often leading to unexpected weight loss. As these cells grow, they demand more and more of your body's energy. This energy, which is usually provided by the food you eat, is diverted from its usual pathways, causing your body to burn more calories than usual, leading to a drop in weight. Now you might wonder, which types of cancer commonly cause this symptom? Well, the usual suspects include lung, pancreatic, esophageal, and stomach cancers. However, it's important to remember that unexplained weight loss can also be a sign of other illnesses, not just cancer. You might also be thinking, how much weight loss should trigger a visit to the doctor? While there's no hard and fast rule, medical professionals often consider a loss of 10 or more pounds within a 6-month period without trying to be significant. So if you notice such a change, it's time to make an appointment with your healthcare provider. Now, this is not to say that every instance of unexplained weight loss is a cancer warning signal. Other health conditions could also be at play, such as thyroid issues or diabetes, but it's crucial not to ignore this symptom. It's always better to err on the side of caution and get checked. Remember, acknowledging a symptom is not about inducing fear or panic. It's about being proactive and taking charge of your health. It's about understanding your body and recognizing when something's not right. It's about listening to your body and responding to its needs. So, remember, weight loss that can't be explained isn't normal. Don't ignore it. Seek help. It might be nothing, but it could also be something. And catching that something early could make all the difference. Changes in your skin can also be a telling sign. That's right, your skin, the largest organ of your body, can provide crucial clues when it comes to spotting signs of cancer. Let's start with yellowing. This is often associated with a condition known as jaundice, which can indicate problems with the liver, gallbladder, or pancreas, all areas where cancer may develop. If you notice a yellowish tinge to your skin or eyes, it's essential to get it checked out as soon as possible. Now let's talk about darkening. Hyperpigmentation, or darkening of the skin, can sometimes be a symptom of cancer, particularly melanoma. It's not just about the skin getting darker, but also about sudden patches of dark skin. Then, there's redness or inflammation. This can be a sign of skin cancer or even a rare form of breast cancer known as inflammatory breast cancer. If you find an area of your skin that's persistently red or inflamed, it's definitely worth discussing with your doctor. Sores that refuse to heal are another red flag. If you've got a sore that's not healing in the way it should, it could be a sign of skin cancer. And it's not just sores. Any wound or bruise that doesn't seem to heal as it normally would warrants a visit to your healthcare provider. And finally, we come to changes in existing moles or freckles. Keep an eye on the ABCD rule: asymmetry, border irregularity, color variation, diameter larger than a pencil eraser, and evolving or changes over time. If you notice any of these changes in a mole or freckle, don't hesitate to get it checked out. Remember, the skin is our body's frontline defense and a window into our internal health. It's crucial to keep a close eye on it and take note of any changes, no matter how minor they might seem. Early detection is key in the fight against cancer, so keep a close eye on your skin and don't ignore any changes. Persistent pain that doesn't go away could be more than just an annoyance. Pain is a complex phenomenon, a sensory and emotional experience that is unique to each individual. But when it becomes persistent, it might be signaling something more serious. Certain types of cancer can indeed cause pain. Let's delve into this a bit deeper. The pain associated with cancer can come in various forms. It could be a dull ache, a sharp stabbing sensation, or a throbbing pain. It might be constant, intermittent, or it could come and go. The location of the pain can also provide clues. For instance, persistent headaches could be a sign of brain cancer, while ongoing pelvic pain might hint at ovarian or prostate cancer. It's important to note that pain can be a late-stage symptom in many cancers, manifesting only when the cancerous cells have spread or grown. This, however, is not a rule set in stone. Certain cancers, like bone or testicular cancer, can cause pain in their early stages. But here's the catch: not all persistent pains are indicative of cancer. Conditions like arthritis, fibromyalgia, or even certain injuries can cause ongoing discomfort. This is why it's crucial to understand the kind of pain that should raise a red flag. So when should you seek medical advice? If you experience persistent pain that is unexplained, doesn't improve with time, or is paired with other symptoms like unexplained weight loss, fatigue, or changes in bowel movements, it's time to consult with a healthcare professional. Remember, the goal is not to cause panic, but to promote awareness and proactive health management. Early detection of cancer significantly increases the chances of successful treatment. Pain is your body's way of telling you something isn't right. Listen to it. The body has its own unique language of expressing distress, and pain is a part of that language. Listening to your body and responding promptly to its signals can make a world of difference. Don't ignore persistent pain. Seek help, get checked, and take control of your health. Your toilet habits can tell you a lot about your health. It's an unexpected truth, but one that's vital to understand. Changes in bowel or bladder habits can be signs of certain types of cancer. It's not the most glamorous topic, but it's one we need to address. Let's start with bowel habits. You may notice a change in the frequency of your bowel movements, perhaps moving from regular to irregular or vice versa. You might also see a change in the consistency of your stools, such as persistent diarrhea or constipation. Blood in your stools is another sign that should not be ignored. These can all be indications of colorectal cancer, among others. Moving on to bladder habits. If there's a change in your urine color or consistency, or you find yourself needing to urinate more frequently, it might be a sign of bladder cancer. Blood in your urine is another symptom that should prompt you to seek medical advice. And let's not forget about pain or burning during urination, which can also be an indicator of something more serious. Now, it's important to remember that these changes can also be symptoms of less serious conditions, such as infections or dietary changes. But if these symptoms persist, it's crucial to consult your healthcare provider. Early detection is key in the fight against cancer, and the sooner you address these changes, the better your chances of successful treatment. Don't let fear or embarrassment stop you from seeking help. Your healthcare provider is there to support you, and there's no such thing as a silly question when it comes to your health. This is your body, your health, and you have every right to understand what's happening. So keep a watchful eye on your toilet habits. They might just be the first line of defense in identifying a potential health threat. Remember, cancer is not a death sentence. It's a battle, and like any battle, it can be won with courage, vigilance, and timely action. Don't be embarrassed about discussing these symptoms. It could save your life. Unusual bleeding or discharge can be a sign of certain types of cancer. This statement might sound a bit alarming, but it's crucial to be aware of it. The human body is a complex system that communicates with us in various ways. Sometimes these communications come in the form of symptoms that we shouldn't ignore. Now, when we talk about unusual bleeding or discharge, what exactly do we mean? Well, this could be present in several forms. For women, it might be spotting or bleeding between periods or after menopause. This could be indicative of endometrial or cervical cancer. On the other hand, for men, blood in the urine could point towards bladder or kidney cancer. In both genders, persistent bleeding from the nose, gums, or in the stool may signify different types of cancer, including lung or colorectal cancer. Similarly, abnormal discharge, such as a bloody or clear fluid from the nipple, could be an early symptom of breast cancer. It's important to remember, however, that not all unusual bleeding or discharge means you have cancer. There are many non-cancerous conditions that can cause these symptoms. This includes simple things like a nosebleed due to dry air or a urinary tract infection causing blood in the urine. But the key point here is unusual. If these symptoms are new, persistent, or worsening, it's time to seek medical advice. Listen to your body. You know it better than anyone else. If something doesn't feel right, it's always better to get it checked out. Early detection significantly increases the chances of successful treatment. Thus, being aware of these symptoms and acting promptly can make a world of difference. In conclusion, unusual bleeding or discharge can indeed be a sign of cancer, but it's not always the case. It's one of the ways our body communicates that something might be off, so it's essential to pay attention to these signs. If you notice anything unusual, don't hesitate to talk to your doctor. It's your health, your life. Don't take it lightly. Always remember, early detection is the best protection. Cancer is a serious disease, but early detection can improve outcomes. As we've explored throughout this discussion, the common symptoms of cancer can range from unexplained weight loss and skin changes to persistent pain, changes in bowel or bladder habits, and unusual bleeding or discharge. These signs may be unsettling, and it's natural to feel fear or uncertainty. However, it's crucial to remember that these symptoms are not a definitive diagnosis. They are signals for you to seek medical advice promptly. Don't let fear stop you from taking action. The earlier the detection, the better the chances of successful treatment. It's your health, your life, and you're the one in control. Your proactive approach can make all the difference in your journey. In the end, it all comes down to staying informed and vigilant about your health. Remember, knowledge is power. Stay informed, stay vigilant, and take care of your health.